Okay, good morning, everyone. I'm Dr. Natapon from Thailand. Thank you for the kind introductions and having me here to share my experience in my study of the combination of fractional carbon dioxide laser with topical botulinum toxin for enlarged pore treatments. I have no conflict of interest in this presentation. Nowadays, skin quality or flawless glass skin becomes a new beauty trend. And now we know that the pore size also is one of the factors that affecting the skin quality. But usually, the enlarged pore treatment needs multiple sessions, and the result doesn't last long. Let's take a look at the etiologies. Inside the pore, sebum production is the main factors that determine the pore size. While outside the pore, surrounding collagen can help tighten and shrink the pore to make it look smaller. So if we want to shrink the pore effectively, we should focus at both targets. Okay, let's see this study. This revealed that intradermal injection of botulinum toxins can reduce the sebum production and facial pore effectively and can last long until 4 months. So I think that the toxin that is quite common and available in almost setting can be a good candidate to be used. However, toxin injection dermally can cause pain, bruises, and also one of the most concerning problems is that abnormal facial movements. So we decided to try laser-assisted drug delivery. And this study proved that fractional CO2 laser can combine with the toxin safely and effectively for the facial rejuvenation. And moreover, we know that fractional CO2 laser is a very good machine to stimulate collagen underneath and can help enhance the enlarged pore treatment. That's why we came up with this combination. And our study design is a randomized control trial. It's a split phase. We did only one session of fractional CO2 laser on both sides of the cheeks. And on the treatment side, we immediately applied topical incold botulinum toxin, 16 units in 0.4 cc of normal sunlight. And the same amount of sunlight also applied on the control side. And we assessed the result until the 6 months after treatment. We have 15 participants completed our study, most are female with average age at 33. We also seen that on both sides of the cheek, there is a significant reduction of the pore size since 2 weeks until 3 months. However, the effect had been gone at 6 months. But when compared between groups, this one cannot be seen the significant reduction or difference between groups. But if we take a look at the pore volume, there are the significant reductions of the pore volumes only on the treatment side at 3 months and 6 months. And when we compare between groups, we can see that at 3 months, we can see significant difference and that the treatment side can decrease the pore volume better than the control side. And here are the clinical pictures in our study. We can see that the enlarged pore can improve since 2 weeks, but the best outcome can be seen at 3 months. This can be easier to be seen with the pore volumes. Both sides of the treatment and control side also provide a good outcome, especially on the 3 months. And that 3 months, we can see significant difference between groups. Unfortunately, we cannot find a significant reduction of the sebum production by sebumeter on either side. For the adverse effects, we found only mild erythema and folliculitis, which both can be resolved spontaneously in 1 or 2 weeks. Our limitation is that we have only small number of the participants in our study, and we didn't measure the depth and diameter of the cutaneous holes created by the fractional CO2 laser and the real quantity of the botulinum toxins that absorbed into dermis. For the conclusion, even a single treatment of fractional CO2 laser can effectively reduce the size of the pore, and the result can last until 3 months. And however, for the potential synergistic effects of this combination between fractional CO2 laser and the toxin, I think we need more studies to investigate these benefits to treat enlarged pore. Thank you.